This is an ultimate global podcast. Hello, and welcome to our Daily Dose podcast, covering all about day-to-day global affairs. You're listening to Saurabh Kora and George Mavros from Sydney.
Hello, good afternoon to everyone who is joining us from Sydney. Well, I think a couple of times this has happened now, so audience already knows about that. But again, apologies for that. And welcome to today's COVID-19 and Sports Daily Dose podcast, where we talk about this crucial topic of future of COVID-19 contact tracing. But before we discuss about this topic, there are some good news coming up from Australia. And guess what? Australia has now 72% of people with both the doses. And that's what we wanted because a lot of people were not getting vaccinated before. And now after 3-4 months, if we see that kind of figure, then, that really takes that, heart out to the people who are coming out in large numbers to get vaccinated. Isn't it, Joshua?
I think it's a wonderful, the trajectory that we are experiencing right now is amongst the highest in the world. It really is a great thing to be a part of. I really feel the camaraderie, don't you? You can feel it in the air. Everyone is just understanding that we have a job to do and we're getting it done.
Absolutely. And there was, in fact, another news coming up yesterday with respect to the COVID-19 that we all know about. United States closing their borders with the UK and the EU. But now they have eased off all the restrictions for the vaccinated passengers. And also they have made this condition that we are opening the borders, but they have to undergo some contact tracing procedures. The airlines have to collect a phone number. They have to collect an email address of all the passengers who are coming into the country and going out of the country, which will help them to keep a track of who all are coming from a particular flight. And if there is a COVID-19 case being detected, it's easier for them to detect that case. But we all know about how difficult the job of the people has been. And heads off to those people, not only to the doctors, to the nurses, but also to these people who are involved in contact tracing. Isn't it, Joshua?
Mm. These are the silent champions, the silent soldiers, I think, who are keeping us absolutely safe, as safe as we possibly can be. And I'm grateful to you, Sarah, for bringing them up because not many people are. I mean, our contact tracers, our primary healthcare workers, our elderly carers, and disabled carers, all of these, classes of people are serving us in ways that without their crucial help, we would just not be functioning right now.
Absolutely. As you just pointed out, that contact tracers are the silent soldiers. And similarly, around the world, they have been doing a great job, not only in Australia, but also in US, in Singapore, in UK, around the world, they have been doing a great job. But what some of the officials now are saying and experts are saying that it's getting beyond their control. If we look at these numbers from United States, just one county, which is the Los Angeles County, it has continued to struggle to reach, the infected cases. Now, if you look at the people that the contact tracers were interviewing last year, there were 70% of the infected residents were being interviewed. But this year, it has got down to 40% of the people being interviewed because the numbers have increased drastically because of the transmissibility of the Delta variant. And that's why a lot of experts in Australia, including Professor Mary Laus from UNSW Sydney, believes that even New South Wales cannot keep a track of their cases because it's just getting out of control. And now we just have to focus on getting people vaccinated and then open up the economy and probably going for those snap lockdowns in some particular areas where the cases increase drastically.
It's an interesting discussion, isn't it? I would suggest that, in taking a snapshot of where we are at the moment, as you said, we're at 72 first dose vaccination. We're approximately 2.5 weeks away from that 70% double dose. And I think that we are about to engage in a transitionary period over the next couple of months, say, where we will need to say goodbye to statewide lockdowns. That is something that should not be considered for very much longer, as across the board the consensus remains. However, the comments about contact tracing, I think at our levels at the moment, I mean, of course it makes sense. It's easy to understand. When there's one case in the community, contact tracing has a very effective capacity. However, even at these numbers of 1,000 cases a day, it is still effective for the particular case that where the contact is traced. I think that we will, as the numbers will undoubtedly rise when our lockdown is eased, as the case numbers rise, what will need to be what government officials, I think from what I've heard amongst my colleagues and whatnot, are considering prioritizing particular types of particular circumstances where contact tracing is deemed relevant. So that could be, in schools or in aged care facilities, or particular hotspots of vulnerable communities where vaccination rates may be low. There are certain circumstances where contact tracing will perpetually be relevant. But it is an unfolding story, and I think that we still have a long way to go to further understand where its relevance will lie. What do you think?
Absolutely. And I think it's a very tough job because just reading, few of the stories of the contact tracers really, breaks your heart sometimes, the kind of hard work they are doing. And so what I was listening to from one of the Australian contact tracer was not the Australian one, but the US contact tracer. They have started sending a text message to every possible person whom they consider as a possible infectant of COVID-19. But, after some time, people are also getting irritated. At the beginning of the pandemic, it was new to them and they were not knowing about a lot of things. But now, as and how it's getting older and older, there is some sort of COVID fatigue amongst the population, because of which people are irritated, people are frustrated, people don't want any lockdowns. And that's why if somebody calls and asks them that, do you have COVID-19, they are not ready to answer them. But now that's what the job of contact tracers are, and that's how it's getting so difficult for them to keep a track of all possible infectants. And that's the situation. What happened in New South Wales in June, we never expected that suddenly there will be 1,000, 1,200 or 1,300 cases per day coming every day. And an example of that was already shown in India. India in April rose suddenly to so many cases, and we all took it lightly here because we thought that it will not happen here. And I think it was a big mistake, because the kind of transmissibility it had, even one mistake could have costed that. And that's what happened. There were few mistakes in the home quarantine system, and the quarantine that was there in hotels, and that's what resulted in those cases rising around the world, isn't it?
Yes, it's interesting because, like I said, I think contact tracing is critical in I suppose minimizing the mistakes that can very easily be made in the situation of particular breaches of quarantine or whatever errors occur. But as I mentioned, we have that when considering in the long-term future, what is the future of and the role that contact tracing will play more broadly. I think in the short to medium term, over the next couple of months, for the remainder of 2021, it will remain important. I think at least from the capacity of what is called test, trace, isolate, and quarantine capability, TTIQ, which is I have only heard a couple of times, but it effectively is our capacity to completely surround every COVID case and minimize and prevent further infections from occurring. That is going to become greatly diminished as lockdown is eased. So that's why we'll see what happens when we don't have adequate contact tracing due to exploded numbers where the person power simply can't keep up with the number of cases. In fact, as I heard on an ABC interview that on a segment that they're actually employing Western Australian contact tracers at the moment. So in the long term, very difficult to say, I think.
I think one of the points was also related to this fact, which I've just raised on the screen. It's related to manual versus digital contact tracing. There was, a beautiful article which gave you a glimpse into how these two different kinds of contact tracing methods have been efficiently used. And over a period of time, there are some deficiencies in both these kinds of methods. You can understand from the manual one, you require more people on the front line, always tracking down the people one-on-one. And with the digital one also, it's very hard for the people to do a lot of things. There have been some issues with those contact tracing mobile apps which have been developed. So what probably the researchers can start thinking upon, and that report was in fact looking at the future pandemics. We have not even got rid of the current one. That report was talking about the future pandemics, but it's a good study because these kind of pandemics are now expected to come every now and then. So it's a good study for people to dig deeper and understand what can be the best tracing methods for such a situation.
Did you say research methods or contact tracing methods?
Contact tracing methods.
Yes. So yes, I think. Look, we are it varies community to community. I think that potential to engage in digital is better from the standpoint of longevity. We just need to check out. I think that's a huge missing link to this, because obviously if you consider the case of someone in the afternoon going into a Woolworths in the late afternoon or early evening who has COVID, if you have not checked out when you visited in the morning, you will be contacted, and that is an incredibly more significant workload for the contact tracers to do their job. It increases their workload by many hundreds of times fold. So that's why I would suggest that digital is better, but as records are kept, they can't be lost, and the details are able to be more kept privately and secure for security purposes.
Yep, I'm just sharing one example with you, Joshua, which I think you must have read, and which now you can see on the screen as well. There was one Northern Territory resident who returned to his place, I think yesterday morning, where he was traveling from Newcastle via Queensland, and he got COVID. And now he traveled to Northern Territory, and now authorities are trying to trace him back and trying to get back to his contacts, his close contacts.
Yeah.
And then his close contacts, it's so difficult to find that chain of links. And once that chain of links keeps on getting bigger and bigger and bigger, it just becomes difficult for any health authority. Last year, Australia, New Zealand, Singapore were doing well because the cases were under control and the Alpha variant was not transmitting as quickly to the other people as this one. That's why they were able to keep track of that. So I think, don't you think now it's the time, and I think we have been raising this point in a lot of now daily dose, that it's so important for people to get vaccinated, because once you get vaccinated, it will reduce the chance of any further mutants or variants of this virus getting generated in the coming few months, isn't it?
Yeah, I think, look, vaccination is the one and only stable and strong response that we as the human race have in the face of such a deadly virus. This is a once in 100-year event. And so this is not easy to overcome. It is difficult. And the vaccines that are being developed and have been developed, if they pass the screening processes, they are safe. Every vaccine has side effects. Every vaccine has the 1 in a million situation, similar to any type of medicine that you take. similar to any food that you take with allergies. It is just another thing that is nearly perfect, but nothing is perfect on this earth. And I think people get extremely caught up in the concept that just due to the hypersaturation and hyperfixation that our societies and the media have on these vaccines, that the side effects are exacerbated to a point beyond recognition, such that if you feel comfortable driving a car and yet are afraid to take the COVID vaccine, your priorities are completely reversed. You are so much more likely to become injured in a car accident than you are to take the COVID vaccine. You are more likely to get sick from the COVID vaccine than you are to get sick from the vaccine. Ergo, the safest option for you is to get vaccinated. It's a simple, logical, and unequivocal truth, and it is simply categorical that to vaccinate is to help yourself, to help your family, and to help the community, and by extension, the world.
Yep. And I think in continuation to your question and the arguments that you've just raised, Joshua, this is the question that we ultimately need to ask is, what's the way moving forward, considering the fact that now contact tracing has got its own merits and demerits. It will have some sort of defects as well. But the ultimate question is how well we are going to make use of the already existing system, considering the manual and digital tracing methods we have. So keep on isolating yourself when the economy is open, and also try to reach out to people and be truthful to the health authorities when they ask you that whom did you meet in the last 14 days. Sometimes we are not truthful because we are scared of the fact that if we tell something or if we reveal our identity, people might look at us in different way, or our name might get public. There have been some scares back in India. That's why people are not so open to talk about if they have COVID-19, they will just keep it secretly growing at their within their communities, and after 14 days you'll come to know about that.
Moving forward is something we all want to do, and I would suggest that the way forward in relation to vaccines is, once we get to that point, coronavirus will become everywhere. It will become a disease that you may get, just like the flu. If you are vaccinated, then you are under a much safer pretense. So there shouldn't be any fear or concern about that fact. From that, of course, I believe that there will be a destigmatization. I'm not even sure if that's a word, relating to the disease. People will begin to lower the significance of the disease in the community, and that, I think, has not happened since the commencement of the pandemic. I think we're yet to see people consider coronavirus, even though we experienced nearly a year of I suppose minimal to no cases here in our state. It still was perceived as something extremely dangerous. I think it will, as we become vaccinated, it will settle, and over the months and years, we come to consider coronavirus just as another vaccine, that a booster we need to take every year, just like the flu. I understand that Novavax, one of a pharmaceutical company, is working on a dual vaccine. So you just need to you'll get your your seasonal flu/COVID booster shot once a year. I also envisage that from that, people will be protected against the flu when they otherwise would not have been, thus reducing mortality against the flu virus. So that these are the long things moving forward. Get vaccinated, reduce the severity, the perception of your mind. We shouldn't be, the age of fear, I believe, will come to an end, and we can move on with our lives finally.
Yeah, and I think it will be a coordinated effort of all the stakeholders, including the bureaucracy, the health officials, the people coming together.
Absolutely.
After the lockdown is over in different countries, I'm sure that the lockdown is already over in a lot of countries, barring the country we are in at the moment. Because we are too safe, we are too protective about ourselves, isn't it? So because back in my country, in India and a lot of other countries, they're not even taking care of the cases coming up in the day on a day-to-day basis. But again, I think it's not anything against lockdown or for lockdown or anything against contact traces. What is the point here is get yourself vaccinated, guys. If you are listening to us to this podcast, and if this podcast is reaching out to you in some or the other way, try to get yourself vaccinated if you haven't done so till now, because that's the solution to come out of this pandemic. And that's what one of the PhD students from UNSW Sydney is also telling you. Any final comments, Joshua, before we end today's podcast for the people?
No, I think you've said it, Saurabh. I think please get vaccinated.
Okay, great. We hope to see you again, Joshua. And again, to our audience, don't forget to follow our channels on Apple, iTunes, and Spotify. You can find us with the same name there as well. And also, as I told you last time when Joshua visited, he also is running a great show of 50 seconds called Joshua's Lockdown Lowdown. So don't forget to follow his page on Instagram and Facebook. I'm sure he's doing a great job to entertain you.